Today is World Cancer Day, and organizations are urging people to be more healthy and also reduce their risks of contracting cancer. Lorraine Govender, the National Advocacy Coordinator at the Cancer Association of South Africa, joins us now. A very good afternoon to you, Ms. Govender. Thank you so much for your time. Now, tell us about World Cancer Day and what it is that this particular day aims to raise awareness of.
Thank you, and good afternoon to everyone. Thank you for having the Cancer Association present today on this very, very important day. So, World Cancer Day is an opportunity for us to create more awareness on cancer, the disease. It is quite a huge impact that we face in South Africa as a result of the cancer, the disease in many, many people. And I think following on UICC's call, which is I am and I will, we are pledging to South Africans to use this day as an opportunity to change the behavior, change the way you look at life, your outlook. Look at how can you change your lifestyle habits. These are some of the things that we are hoping to change among South Africans. And this is what we're pledging to people. Let's change the perception of cancer. Let's support more people. What is your pledge today in terms of I am and I will?
That's quite an interesting commitment in the way that you phrased it, I am and I will. I mean, this has actually been a commitment that those who support this day have been doing for the past 2 years. But give us a practical example of how an I am and I will statement could go.
Okay, thank you so much. So I think if we look at tobacco, let's just talk about tobacco. We all know that tobacco use is the single most preventable cause of cancer. So just looking at that and looking at the impact that it has on the disease itself, I'm not sure if many people know, but it's related to over 20 different types of cancers worldwide. So when we talk about I am and I will, let's just say I am a smoker and I will quit this habit. This is just an example of what people can do. Or it could also be, if we look at alcohol, alcohol is a group 2 carcinogen and related to so many other cancers. People can commit, I am consuming alcohol and I will change my habit. Or even if we look at the support part of things, when you look at a cancer patient, we all know how huge it is in our country, and support is one of the main things that cancer patients need after treatment. So what can we say? You can say, I am aware of a cancer patient and I will do things to change or help and support a cancer patient. Or I am a citizen in South Africa and I will volunteer for cancer. So those are some of the commitments that we are asking people to pledge on this important day.
You mentioned about the really influential role that tobacco smoking plays in cancer. You said that it's responsible for over 20 types of cancers. What are the other habits or foods that perhaps contribute to one getting cancer?
So if we look at it's such an interesting question, because if you look at the cancer burden in South Africa, and if you look at the top 10 cancers, and if we look at what are the lifestyle cancers, there's so many. If I could just list among women, breast cancer, cervical cancer, colorectal cancer, lung cancer, uterine cancers. Just looking at colorectal cancer, the fact that it is a lifestyle related cancer and featuring among the top 5, both in men and in women, that alone tells us changing our lifestyle habits can definitely improve our outcome after early detection. So when we talk about eating healthy, that's an option for you. Getting active, obesity is one of the causes of many cancers. Just getting active, reducing your risk in terms of the amount of time we spend in the sun, which results in skin cancer, cutting down your habit of smoking if you're a smoker. And, I think it's also important for listeners to know that we all need a smoke-free and healthy environment But when you use tobacco, it not only affects the user, it also affects the people that are present in that room where smoke is being exhaled. So those are some of the important things that we can change. And it's small things, it's little habits that we can change in ourselves that will have a long-term impact in terms of our cancer incidence.
And talking about impact, Ms. Govender, we've heard from various HIV/AIDS activists and bodies saying that COVID-19 has adversely affected them as far as research and perhaps even money and attention going to their cause. Have you found the same with cancer? How has COVID-19 affected, activity around cancer and awareness?
Thank you for that. So in 2021, the Cancer Association celebrates a very significant milestone on its 90th anniversary of educating and reducing the cancer risk and showing enduring support and care. We are grateful that we are still making a difference in the lives of those affected by cancer. And as part of the World Cancer Day, we challenge individuals, families, companies, schools, service organizations to partner and work with cancer to raise awareness of our vital services so that we can contribute to helping build a world without cancer, and also to show that cancer patients are not alone. So the Cancer Association, being an NGO and a nonprofit organization whose sole income is through fundraising, has been deeply, deeply impacted by the COVID pandemic. It's very difficult to keep our offices open, to remain sustainable. And yes, the TERS income did help us to some extent, but unfortunately, going in now in this new year, we will be seeing some changes within the organization. But on the other hand, we are very, very hopeful because COVID also gave us an opportunity to look at different ways of working with communities. We were very fortunate to establish our telecounseling line, which is available to all cancer patients nationwide for free. We've done a lot of Zoom support to our cancer survivors. We've done loads of webinars using the Zoom platform to educate the people on the cancer risk. Our care homes have remained open during the entire time of COVID to ensure that our cancer patients still had a place to stay while they went for treatment. So despite the challenges, we are very grateful for the support of many individuals that have helped to ensure that our service offerings remain at the forefront during this time.
Ms. Govender, thank you so much for your time as we mark World Cancer Day. That was Lorraine Govender, the National Advocacy Coordinator at the Cancer Association of South Africa.